Yes. Hello, everyone. It's Dr. Tamara Beckford, and welcome to the Dr. Tamara Beckford Show. I am excited because we're going to be talking about us ladies. That's right. Today, we're going to be talking about hormones in weight gain, especially in menopause. Now, menopause, the thing about it, as long as we've been alive and as long as women have been here, menopause have been an issue. For some strange reason, it has not been taught that much.
Yeah.
We're still trying to find out more and more information about it, which is crazy because if we really look at it, like come on now. This is 2024 and we're still trying to learn about menopause
Yeah.
when we have been doing medicine for how long, right? But it's such an important topic. It's been overlooked for way too long. And our doctors are here and they're like, no more. No more. We're going to all talk about it. We're going to talk about the roles of hormones, how they cause weight gain, and then also about how it affects us, especially us ladies, during menopause and perimenopause. And I'm bringing on an expert to do so today. Alrighty, so my guest today, she is a graduate of the University of the East in Philippines. ¿Cómo está?
Perfect. Galing,
Thank
ah.
you.
Magaling.
I love it, love it, love it. She did her family medicine residency at Penn State Hershey/Good Samaritan. She's board certified, not just in family medicine, but also in obesity medicine and culinary medicine. She is the physician CEO, founder, and passionate ambassador of reMDy. Her interest is in perimenopause and post-menopausal women's health and brain health, right? Why? Because she has served as a physician leader in many, many different roles. Now, one of her roles was a physician leader and medical director of WellSpan Medicine Weight Management Program. While she was in that role, she developed and implemented a dual telehealth and in office practice to increase access to evidence based obesity care across central Pennsylvania. Who am I talking about? I'm talking about Dr. Caissa Troutman. Hello, Dr. Troutman. How are you?
I am amazing. Thank you so much for having me.
Hey, thank you so much for stopping by the show. I'm excited because we're going to be talking about all about hormones and how it affects us. And there's just so much that we need to learn. And unfortunately, during our training, it wasn't really that.
No, exactly.
Yeah,
And as you were saying earlier, right? Women are 51% of the population, but we're so behind in taking care of ourselves.
absolutely.
It's
So we're
crazy.
going to dive right into that. But before we get into the meat of all of this, let's get to know you a little bit better. So let's talk about what made you decide to be a doctor in the first place.
Yeah, how much time do we have? But just
I
kidding. So
know,
yeah, so
right?
it's funny. I'm actually the first physician in my family. Both my parents were actually teachers. They actually met in high school. They were both high school teachers.
Mhm,
I think gravitated towards it because I love just science in general.
mhm.
Yeah, I have that like I don't know that brain that wants answers to everything.
Yes.
And when I was in college, actually, my dad passed away from kidney transplant complications. So I think
Mm,
that was kind of one of the things that opened me up really to the idea of, hey, I can be this, I can do this. This could be
right.
something that I can do.
Mhm.
Yeah, yeah.
So it's the love of learning. It's being around educators because I mean, both your parents are teachers.
Yes.
Guess what you're gonna do? You're gonna learn.
Yeah, education was just like a big deal,
A
in
big
my family.
deal. But then also you got to experience the healthcare industry, or
Yeah.
I wouldn't even say industry at the time, but just really healthcare
Yeah.
through a personal portion where your dad being ill, needing a transplant, and then you seeing him having a transplant and also the complication of passing from the complications of having a transplant. So it fueled even more of a love for learning and a love for you wanting to do more.
Yeah,
Alrighty.
for sure.
So now that you're there and you're like, I have this love for learning, and I needed this energy boost and I'm gotten it. So now you're moving on, right? And you're like, okay, I'm not only going to be a doctor, and now I'm going into medical school, but then I've decided that I want to be a family medicine doctor. So what made you decide to do that?
Right. If travel halfway across the world,
Oh,
because
man.
to go to the US and do my medical residency, because I did
Mm-hmm.
all my training back, my medical school training in the Philippines, and
Okay.
I guess I have just the adventurous spirit.
Yes,
you
ma'am.
know, yeah.
How many hours from where you are to
A,
the
a
Philippines?
flight is like 12, 18 hours. Oh my God, it's been a
18.
while since I went back home.
Yes,
Yeah,
so around 18 hours. Yeah, it's just not 4.5.
no, it's not. But
So you
yeah, yeah.
decide so you decide family medicine. There's so many different specialties. So what brought you into family medicine?
So it's funny. I actually wanted to be a neurologist. That was my first kind of, but
Mm-hmm.
life, I guess, I didn't match to neurology, and life made it happen that family medicine was where I got into, and I don't regret it one bit. And I think
Uh-huh.
the thing is, family medicine, as you know, it's just you practice the whole entire lifespan, right? From
Absolutely.
birth to the end. So,
Mm-hmm.
and in there, I just touched so many lives, patients, and just learned a little bit of everything to help them.
Right.
So
I
love
call
it.
them medicine. I call it from the cradle to the
To the
grave.
grave.
And
Yeah,
you are, like you say, you're touching lives through all the lifespan. The
exactly.
lives that are coming in, the lives that are going out and transitioning, your life that's emerging. They're
Yeah.
just so much. Like,
Yes.
like you said, that you have the impact on all phases.
Yeah. I mean, props to primary care, because we know that that is the hardest. I mean,
Mhm.
everything is hard, right?
No,
But
no, no, no. It is.
it,
I'm emergency, and I give kudos
yeah,
to my primary care people because
yeah,
you're right.
it's the
It you
hardest job,
it is. It
Mhm.
is. You guys are the heart of medicine. You take care of the population. You help to prevent things. You're training. You're trying to have the population understand not just themselves and the sickness, but also health and
Right?
wellness.
Yeah. Yep.
And
Yep.
it's a hard job,
It
and
is.
in this climate it's even harder because the
Oh,
time
yes,
to
for
do it,
sure.
it's shorter, but you are trained to help. You're trained to teach. You're trained to develop.
Yeah.
I
Yeah.
love it. Alrighty, so we're family medicine, but for some strange reason, I noticed that as a family medicine doctor, you didn't stop there. So tell me, what
I did
made you
not.
decide
Yeah.
to go further?
So I always tell, really, my life, my professional career, I think as of the
Mhm.
last like 10 years has somewhat so I've been practicing for 20 some years, right? The
Mhm.
last 10 years, I'd say, has somewhat followed my life and my own personal struggles. Uh,
Mhm.
so I've struggled with obesity and weight my entire life. It's up
Mhm.
and down, up and down.
Mhm.
Even as a child, I've struggled with my weight. And just like anyone that's or any type A personality, like when I'm in it, I'm in it. So I do everything right, and I would lose weight, but it was so hard to maintain. So I'd be
Mm.
up and down, like med school, residency, children. Then I would see my weight go
Yeah.
up and up. So for me, it was just there was just that a, a time where it's like I gotta do something, and
Mhm.
from there I kind of deep dived into the science of it, and recognized and realized there was actually a science to how to treat weight. It wasn't just about willpower.
Mm.
And that is where I went on my own personal journey, and I've lost and maintained 32% of my total body weight in the
Wow.
last kind of 5 years. So um yeah, that's
Wow.
kind of why when I was doing my own journey, I'm like, oh, this is really good. I can probably do this. So
Mhm.
that's when I again, as luck, or really as God put in the path in front of me, I was burned out from a one job, and I said I went to interview for another job, and I said I want to devote a part of my practice strictly for helping patients lose weight. And that's
Mhm.
when they told me, like, actually, we have an opening in our obesity medicine clinic. Did you want to apply there? Like, yes, so
Wow.
it was really God's
It was
plan.
meant to be.
It was, yeah.
Oh, wow. So now you're saying, here's the thing, which is so important what you just mentioned. During your journey of, having the ups and the downs with the weight loss in different phases of your life, you decide to dive into the science of it. And then you realize, like, wait a minute, there is a science to weight loss, and it's not just willpower. There's more to it than what we have been taught. There's more to it than what, you see in the media, and what the I'd say the culture usually puts out, right? Where
Right.
willpower and, calorie deficits and this and that are ways, the only way that you can do it. And if you have not succeeded based on those things, it's because you haven't tried hard enough. And,
Or it's
so
your
now
fault,
it's
right?
your
Yeah.
fault. Absolutely.
Yeah.
But you recognize that, wait, there is a deeper science to weight loss and obesity medicine. And not only that, you've gotten certified in it and have
Right.
been able to really use that. So what were some of the things that you're like, oh wow, did you know this?
Oh
Did you
my
know
God.
that?
So many. And this is where that love of learning comes from. And that's
Yeah,
why I've been collecting certifications, because I'm just like, hey, I'm looking into it. I might as well get, of making it
certified.
official. So, oh my God, so many things, and I gotta say, practicing obesity medicine and what I've learned about things just reinfused that joy in practicing medicine.
Mm,
Like I said, I was burned out, like
yeah.
many, like what, 95% of the our physicians right now. And it's just really like, it brought back the love for medicine and taking care of my patients and
Mhm,
impacting their lives in a powerful way, because it's not just about treating afterwards. It's like,
mhm,
changing, things before it happens, or even if they were, let's say, have the disease of diabetes or hypertension, let's stop their medication. It was such a good time when they've lost a certain amount of weight, 5 to 10% of their total body weight, and
mhm.
now we can stop their cholesterol, whatever, right? So that
Right,
was,
right.
I think, such an amazing thing. But again, I mean, and then from there, I was like, all right, how can I help my patients more in their nutrition? So that's where I did the culinary medicine, because this
Mhm,
is culinary medicine is really just breaking down nutrition in a way that's understandable to the patient. Like,
mm,
as a family doctor, I knew what Mediterranean diet is. I knew what dash diet, but I didn't really know how to explain that and actually
mhm.
like break it down for my patients. And that that learning more about it, I can help myself. Again, it's all about being selfish. I help myself first, because
Mhm.
honestly, that's how I learn, and then I help my patients with that too. So
Wow. Wow. Alrighty. So here's the thing too. So we've learned all of these things through, like, the obesity medicine certification, also the certification from culinary medicine, where you're now deep diving and you're now able to articulate to your patients
exactly,
the
yeah.
things that you've already, like, I know Mediterranean diet is good, but it's like, okay, well, how can I explain it to you? So now you've gotten that. But then there's this phase that you kept getting drawn to, which was the menopause and perimenopause and hormones that affect this and cause weight gain in women. What drew you to that initially?
Well, same thing again, because I'm going through it. So I'm a woman going through perimenopause,
Mhm,
and so it's the same thing in the sense, like, okay, something's going on. What's
mhm,
going on with my brain? I was getting brain fog, insomnia, waking up at 2 or 3 a.m. and not going back to sleep, headache. So whatever is going on in my life, like I said, I'm like, I gotta like figure this out, and I would deep dive, and then maybe this again, it's an intellectual, like
mhm,
investigative kind of had, but um also in taking care of my patients in my practice, majority of my patients are women, are
mhm,
midlife women that are struggling to lose weight.
mhm,
And a very very common story I would hear is like, Dr. Troutman, I've not changed anything in how I'm eating. I'm not changed
Yeah.
anything in how I'm exercising, but I am gaining weight. I'm getting it all in the middle. So,
Mhm.
it is something that I've heard many times before.
Mhm.
And just deep diving into, again, specifically the hormones related to perimenopause, menopause, there's definitely that connection. And I did want to just clarify one thing is, obesity and perimenopause and menopause are two distinct medical conditions,
Mm.
but they do tend to overlap,
To
right?
overlap,
Yeah,
absolutely.
yeah,
And one of the things that merges them together is the infamous hormones.
yes, yeah,
So let's deep dive into
yeah,
that. Oh my goodness. So, what are some top five hormones that are relevant that we probably are overlooking, not thinking about that's there that's causing weight gain, especially in our women in
yeah.
menopause, perimenopause area, that it's just so important for us to recognize the
Sure, for
importance of
sure.
their relevance.
Yeah. And what I'm going to say now may not be what people would first think when I talk about
Which
hormones.
is why it's important.
Yes, yes. So the first hormone, there's actually like four hormones I talk about just in my patients that struggle with weight, right?
Hmm.
But we're gonna give the extra one, for bonus points, right? So
Absolutely.
one is ghrelin. Ghrelin is literally called the hunger hormone. Okay,
Yes.
but let's kind of back up a little bit. When it comes to our weight, whether we're in the perimenopause, menopause, or we're a guy, the brain is the master regulator of our weight.
Right.
Brain is the master regulator of our appetite, our hunger, our metabolism. So the brain is that central processor, right? And it gets fed the signals
Hmm.
from our periphery, like a stomach, our gut, our etc. So when we have that central processing, and then we give the signals to the brain, the hormones are those signals that can
Right.
influence that. Yeah. So the first one is ghrelin. It sounds like gremlin. My patients always say that sounds like
Oh, it
gremlin.
sounds like
Yeah.
it's the gremlin.
Yeah.
Well, it's kind
Which
of like
makes sense because actually it's like hunger, hunger. I want to eat more, right? Like that 80s movie.
yes, yes.
So ghrelin is literally the hunger hormone. So when it goes up, we tend to be hungrier. When it
Hmm.
goes down, we're not as hungry. And this is actually impacted or affected by a lot of things. When I talk to my patients about treating weight for health gains, not just for a number on the scale, I talk about the four pillars: nutrition, physical activity, stress and sleep management, and medication as a tool. So we use those four. And
Hmm.
how can we make changes to the ghrelin based on those four things? When we eat certain things, the ghrelin goes down. When we
Ah,
sleep better, ghrelin goes down. When we move our body, ghrelin goes down. So any of the hormones we're going to be chatting about, there are things that we can adjust both in nutrition, lifestyle would be nutrition and physical activity, and stress and sleep, and potentially medications to those that fall in the category that would be helpful. So yeah, first is the gremlin.
yes, the gremlin. I mean, the gremlin.
Right, yeah. Yeah.
Mhm.
So second is actually, it's not there's no sexy way of saying it. It's called leptin,
Yeah.
and it's that satiety hormone which
Hmm.
gives us a signal of stop eating, I'm full. Okay.
Hmm. Hmm.
So here's the interesting part about leptin. Patients that struggle with obesity, they have something called leptin resistance. Isn't that
Mm.
where the brain is getting the signal of I'm full, but it's not listening to it. So we
Yeah.
still, we're and again, leptin resistance can be affected by our sleep,
Mm.
stress, so on and so forth. Right.
Absolutely.
Yep. Third, a lot of people know this third hormone, which is insulin. Right. So we
Hmm.
have that insulin resistance. And again, we're going to talk about that about more, maybe about it. Well, actually, we should do now. So patients that are going through menopause and perimenopause,
Hmm.
this is one of the big factors that we struggle with, and that makes it harder for us to lose weight, or why we gain weight.
Yeah.
That estrogen loss increases the visceral fat deposition, so belly fat. I remember hearing a lecture say it's like reverse puberty.
Ah,
Where we get the fat instead of being deposited in our hips,
yes.
it's now going to, like when we were kids, where it's now in the belly, right? And that
Right.
is that visceral fat formation, which increases the likelihood of insulin resistance.
It's kind of like a cycle,
Yeah,
right?
vicious.
So the insulin resistance causes the belly fat, which increases the insulin resistance, which
Yep.
causes more belly fat. So you can just see
And then
how
weight
it's
gain.
when
Yep.
the weight
Yep.
gain,
Yeah.
that
Mhm.
vicious cycle starts.
Yeah. But
Mhm.
same thing, right? There are things we can adjust, we can do with how we're eating to help with insulin resistance. If we're moving, so a common example that I want to share is doing a short walk after a meal can bring down our insulin levels, that I mean our insulin resistance,
Mhm.
so many things. And then the fourth hormone is cortisol.
Oh,
Oh, we all know that, right, Dr.
yes,
Tamara?
absolutely. Our good old friend cortisol. We love you, but we know that you need to be
In our life.
it's just important, but in doses. But go ahead, tell us more.
Yeah, so it's that stress, that chronic stress, right? So the acute stress is perfectly fine when we have to lift the refrigerator, right?
Uh,
But chronic stress, that is where all the badness happens, right? Not just for our weight, but for our weight, that actually increases ghrelin. The gremlins go up, decreases, increases leptin resistance,
mhm,
increases insulin resistance,
mhm.
and what's the source of our chronic stress? It's our life sometimes, right? Busyness. And guess what? For a midlife woman going through perimenopause, menopause, that is like the time, right? So very commonly, that's like a sandwich generation, right? Taking care of kids, teenagers. Like for me right now, I have a teenager going. I have two teenagers, so they're all going through their own hormonal stuff. Well,
Yeah.
I'm going through my own hormone stuff.
Yes, yes. So we can see how that dynamic within the family can increases the level of stress.
Yeah, and they're taking care of aging parents too. So that's a very stressful time
Mhm.
for most women. That could be their the pinnacle of their career, right? So they have more stressors, they have more deadlines, they have more responsibilities. Yet
Oh,
they still have to take care of their family.
yeah.
If they have, it's so it is a very prime time for a major amount of stress.
Oh, wow. This is excellent. And we're going to dive a little bit deeper into it. And I love that when we really think about the timing for all of these hormones and stressors, especially in a woman's life, you're right. It is in that prime time when you are in that either middle or high level portion of your career, right? If you have been around for a while, either you've been 20 something years in that career, so now you're really in more leadership positions, and
The boss, right?
yeah,
Yeah.
you're the boss, you're in which you have a lot of responsibilities. You have responsibilities at work, and then you also have responsibilities to your family. And I say that to the family because even some women who might not have immediate families of their own, they still have that family dynamic. You're the aunt who, or you're the brother, you're the sister who you are relied upon.
Right.
You're
The
the person, you're the
caregiver role.
caregiver
Mhm.
of the family member, or you're the one who, if something goes wrong, people turn to. So you're still making big decisions, even if you might not have a family of your own, such as you don't have any kids, but your role within your extended family might be that go to person. So you're still having that level of stress, and
Yes.
it's there.
Right.
Wow.
Yeah.
So we talked about leptin. No, actually, we're talking about gremlin first. The gremlin. Let's talk about the
It's
gremlin.
gonna stick to you now, that gremlin and gremlin.
Yes. All right. So ghrelin is, like you said, it's the hormone that is just like, okay, me want food now. Me want food now. Hormone, right? Right. So, but we said that there are some lifestyle modifications and also nutritional ways to help to reduce that. What are some? Well,
Yeah.
we could,
Yeah,
yeah.
for sure. So the first one, I mean, nutrition wise, would be macronutrient distribution of your food. So, and this
Mm,
is something I tell with my patient, or I share with my patients. When it comes to
mm,
nutrition, let's work on increasing our protein, right? So
mm,
protein is that one macronutrient that has been shown in several studies that lowers that ghrelin. And
mhm,
the one study that they've actually shown is starting your day, aka your breakfast, with at least 30 grams of protein, can really help lower that ghrelin for
Mm.
the rest of the day, so really
Oh,
helps.
wow.
So
Love
prevent
it.
the snackies,
That's snackies, right.
Mhm.
Okay, and then we also talked about lifestyle modifications such as stress and sleep.
Yep. Yeah. I mean, sleep is huge, right? Sleep
Huge.
is
Yes,
huge. I mean, sleep will affect all the hormones we just talked about.
absolutely.
And guess what? That's the one thing, as busy women, as busy professionals, that's the one thing we sacrifice,
Yes. Yes.
right?
And even when we talk about also how these four plus the bonus one, five
Right.
hormones, which I love, where we're saying that these aren't some of the ones that we commonly think about, because most of the time we're thinking about hormones such as the estrogen, the
Related. Yep.
progesterone, and the
Yep.
FSH and LH. But these hormones do affect our lives. And then sleep is a factor, unfortunately, that gets compromised during this whole phase. And part of it is that sleep is affected because you're waking up so much. Because one of the things that you mentioned is that you're waking up at 2 o'clock in the morning, you're having racing thoughts, or your mind's foggy. You Throughout the day you can't be at your best. But
Right.
being able to try to balance some of these can at least help to try, in addition, be a part of the combination of ways to help you to manage some of all the changes that occur during perimenopause and menopause. Yeah.
Right. Yeah. I mean, so maybe let's do like a quick review on like menopause, perimenopause, right? So
Mhm.
menopause is that cessation of periods for 12 months. But I
Mhm.
just think it's so funny that perimenopause, which is really
Yeah.
the years of
Plural,
life, huh?
plural
Plural,
years.
yeah, yeah. So
The
average age of menopause is
Yes.
52,
Mhm.
but a patient can have menopause at age 45, okay?
Mhm.
And that's natural menopause. And perimenopause can last 7 to 10 years.
Exactly.
It's like, what? Nobody told me that. Kind of,
Right.
kind of like when I recognize that. And perimenopause, um, you may not have you will have irregular periods, etc. It's so funny, right? When we think about menopause, it's defined by a metric based on reproduction, but
Mhm.
it affects so many things. Like, it
Yeah.
affects our brain. I mean, I remember I was listening to a podcast with Dr. Lisa Mosconi, and she was talking about how, again, like, estrogen is the CEO of our brain, and a
Mhm.
lot of the symptoms that we feel during menopause, perimenopause, menopause, is rooted in the brain. Again, the brain is such an amazing thing in our
Mhm.
lives. And so, for example, symptoms like the hot flashes,
Yeah.
headaches, brain
Mhm.
fog, right? Even the mood changes of anxiety and depression. So here you are, right? Midlife, with all these stressors, not sleeping, too much, not a lot of time. And then we throw in the hormonal changes of estrogen fluctuating during perimenopause, uh,
Mhm.
progesterone going down, testosterone going down. So yeah, it's like this perfect recipe, perfect scenario for weight gain.
Yeah.
Because yeah.
Yeah.
So
Chronic stress,
right,
you're having the imbalance of rest, not sufficient, you're not having sufficient rest, I should say.
right.
And then your hormonal changes, where you're probably not being able to manage
Ghrelin,
the
yes,
ghrelin. No, I'm calling it a facetiously gremlin, but the ghrelin hormone and the leptin hormones,
yeah,
which are out of that. And then we can see how that vicious cycle continues, and especially when we talk about leptin, right? And then insulin resistance, because naturally during that time, we start to have the redisposition or deposition of the fat,
right.
which now deposited around the midsection, which we've all been trained in med school that once you start having the visceral fat around the midsection, those medical terms, big terms such as
Yeah.
fat around your belly area starts to increase. They also increase your insulin resistance, which is another part of that vicious cycle.
Yes.
Now, we're talking about now the change, the hormonals, and some of the things that we can do. So we talked about the ghrelin, about the leptin. So what are some ways also to help with that resistance that starts happening within our bodies to the leptin hormone, which is our hormone to say like, okay, I'm full. Thank you so much. I do not need any more.
Yeah, so I think the major one is sleep,
Ah, mm,
getting that sleep. And again, so it's like chicken and the egg, right? Like how do you treat, like who do you treat first? How do you treat first? The sleep, the hormones. So, and I think, the way I would approach it, because I have had that, in my current practice, or in my current practice, which is a direct care practice.
mm-hmm,
I have a obesity help weight wellness arm, and then I have the menopause hormone therapy arm, right? So,
mm-hmm,
but like I said, there's such a big overlap between these populations, medical conditions. So the first question is like, which one do you want to work on first? Because
mm-hmm.
sometimes um improving the hormonal deficit, right? Because again, it's a biological issue. It's not all in our freaking heads, right? Which
Right, right.
I told before, like it really is a biological issue, which is why we are having sleep issues, why we're having and I can just kind of use me as an N of one. Like my
Mm-hmm,
sleep was not great. I thought I was anxious.
mm,
I convinced myself I was anxious. Like I must be anxious. Like why am I waking up at 2 a.m. in the morning? And
right.
the doctor brain's like, I have nothing to worry about, but it's happening. And then, now that I'm on, hormone therapy, it's like it's not gone. Okay, the issue is
Right.
still there, but it's definitely a lot better. And I want to talk about sleep. I've done it all in between. I've done supplements. I've done like cognitive behavioral therapy,
Mm-hmm,
which is amazing in its own for sure. But if the issue is a biological issue,
mm-hmm.
then
If it's
the
not
treatment
addressed at its core.
is a biological treatment. And the same way with obesity and how I treat my patients with obesity. It's like if the issue is again, and it is obesity is a medical condition. It's not a made up thing that is all about willpower. So that this is where the tool of medications is
Mm-hmm,
so powerful and life changing and is
mm-hmm.
needed, especially in someone who has a lot of weight to lose to have health gains, right? And to be a better.
Absolutely.
Yeah, I know I just went off a tangent there,
No,
but
you did not, because this is what I really was able to pull from what you just mentioned. The biggest thing was that you discussed with your patients, because our patients have an idea. There are two roles, as you said, there are two arms to your practice. And one, might be the role of the lifestyle and such as sleep deprivation, and the role of the hormones. So you speak with them and you find out which one would they like, because they both affect that person's life. Which part of the arm would they want to work on first? Because some people might want to work on the hormonal changes, but then others might want to work on the sleep, which will help to affect the hormonal changes.
right. Yeah.
Working on the hormonal changes affects the sleep. So they're benefiting either way, but it's really an individualized portion, because someone coming in might realize that, for me, my sleep is such a big issue. Can you help me working on the sleep part? And then it'll help the hormonal, which in turn still works on the
Yep.
sleep. So I love that. I love that. Alrighty. So now with the insulin resistant portion, let's talk about some ways that we can, and that person will be able to reduce their insulin resistance.
For sure. Yeah.
And you
So
did
with internet,
I do want to say you did mention one, which is after a meal,
yep.
walk it.
Yep.
Yes, yes.
Yeah.
Hmm.
I mean, another one is, and again, I've learned this from other mentors and other my obesity specialist colleagues is, you know, um, to pair what you're eating with either pair your carbs with a protein or a healthy fat.
Yes, yes.
Yep.
So one of
Mhm.
my lovely friend, Dr. Catherine Harmon Toomer,
Oh yeah, I know
yes,
her. Yep. Hmm.
yes, Dr. Toomer, she really, really like honed in on this. And I've had the distinct pleasure of interviewing her a few times on this show, and that was something that blew my mind. As
Yeah.
someone who worked nights, so I am a nocturnist,
Hmm.
and during the time, there, and I'm in the ER. So what happens in the ER at night? snacks.
Yep.
And then it's just like, well, pairing it with a healthy fat, had no clue how important that was, to being able to pair, even if you're having some type of carb, being able to pair it with a healthy fat,
Right.
how that helps in how your body distributes it, and also the order of the meals.
Yes. Yeah.
Blew my mind. If you want
Yeah.
to, to relay that to those who are watching, about the order of eating and how it affects that too.
Right. Yeah. And I'm trying to remember the study. So the idea is, instead of eating, let's say it's Thanksgiving, right? Instead of
Hmm.
eating like the mashed potatoes
Yes,
first,
which is
or
always
this,
go for.
right? Yeah. You can start with maybe a healthy fat or a protein first, then you do the carbohydrate, and that will help with the spike of the glucose, which is then
Mm-hmm.
followed by a spike of the insulin, and then unfortunately whatever goes up must come down, so there's that crash that happens, and when we have that crash, that's when we get even hungrier, jittery and snacky.
Yes,
So yes.
yes. And that was just so important to just learn just these little small but important
Right.
details
Yeah, you don't
in.
have to swear off a particular macronutrient, right? You can.
Right.
You can have
Mm-hmm.
you can have it. It's just a matter of um knowing how to come
Mm-hmm.
to the battle, as I always say, like knowing what to do. Yeah, the strategies.
I love it. I love it. These are just strategies that are so powerful. They're small and powerful strategies that helps one to be able to enjoy, right?
Mhm.
Enjoy their food, enjoy their meals, but just recognizing that can help to reduce some of the hormonal spikes and changes that occur within our body, and especially for those who are dealing with the hormonal changes
Yeah.
during
Yeah.
our perimenopause and menopause, or those who are dealing with weight health. um, you know, I love it. I love it. Alrighty. So cortisol. Oh my goodness. Our friend.
Yes.
We
It's a
love you,
hard one,
cortisol. We don't want you to not be around, but we do
right?
recognize
Right? Yeah.
there's just, go ahead. There's so much to
Oh
it.
my God. Yeah. Where do you start? Right. I mean, I think everybody has their own story, has their own stressors,
Mm-hmm.
and I think what's important is for that person to find out, right? I mean, I could just get out, as we do in medicine. Let's use a patient example. Like
Mm-hmm.
I had this patient that she was doing everything right. She was eating right. She was like doing all hit workouts and lifting, and she was doing all the right stuff, but she was having a hard time with losing her weight. And then a big problem for her was her work situation.
Mm-hmm.
Now I didn't make her leave. I didn't make her like quit her job, but she did, and then is much happier now, and she because she can sleep better, and she
Mm-hmm.
has better ability to handle her life. And so I think it's very, and in some it's relationships, right? In
Yeah.
some it's just handling conflict, in some it's just
Mm-hmm.
making sure you spend some time for self-care, and not just giving and giving and giving of yourself, right? So
Absolutely.
yeah, for me I would say my stressor, I think how I handle my stress is I do a physical activity,
Mm-hmm.
and I journal and meditate. So
Mm.
that's journaling is a big thing for me. That was
To
how
help
I.
to reduce their
Yeah.
stress. So it's
Mhm.
really, like you said, developing and recognizing their tools that are quick, powerful ways that you can help to hone in on the stress, recognizing, what are the stresses and what are some decisions that one might to make. The decision might be what around you is causing you stress. It could be a relationship. And when we say relationship, it could be like, what you consider a friendship, but it's really a relationship that is highly stressful. Are you on the giver's portion consistently? Even when you're tired, you're giving, and therefore your stress levels are at the really, really high level. So once you're able to learn how to manage some of those, then you're able to reduce your stress, which is part of the hormonal portion, and being able to help with your cortisol. Love it, love it, love it.
I
So
think
there are
part of
a
it.
couple
Oh, go
there are a
ahead.
couple people who want to say hello, hello,
Oh,
hello. We
hello.
have So we have Dr. G. She said that this is such a great and insightful conversation. Thank you so much, Dr. G,
Thank
at
you.
the heart of healthcare. Yes, with her morning dove. And then we also have one of my lovely nurses, one of my ace nurses here in the Houston area. She is a wonderful nurse, Dr. Kathy Ramos. She said, "Thank you, doctors. I'm so thankful
Awesome.
I get to
Hello.
listen today." Yes, I love the topic, and I'm dealing with this every day. Yes, 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 Kathy. Love it, love it, love it. You are definitely one of our top nurses. And I'm glad that this topic is helping you and that you're learning so much from Dr. Troutman in this wonderful conversation. Go ahead, Dr. Troutman. You're about to say something else?
Oh yeah. Oh my God. Brain fog. Just kidding.
That happened. We talked about it, right?
Oh my God. What was it? I don't remember now. I think
Hmm.
like we talked about midlife women, right? It's
Hmm.
the issue is pausing.
Yes.
Sometimes we're just go, go, go because we feel trapped or we feel like
Hmm.
this is how it's always been, or we feel like the world is on our shoulder. I mean, I certainly felt that way, you know. I
Hmm.
mean,
Hmm.
I have a quote unquote normal life, but
Right.
I'm a mom, I'm a physician, I'm everything. So we carry so much. And sometimes giving a pause or pausing
Yes. Yes.
feels like such a hard thing to do, but you kind of need to
Have to
know
do
what the
it.
problem, where you can make small changes that's in our power, right?
Mhm,
So,
mhm. I love it. And these changes, it really helps you to reflect, taking that time to pause. It's really bringing everything to a standstill and saying, well, what are some of the changes? Like, and reflect on yourself. What have I not been giving myself that I need to give to myself that will really help to enhance, and part of it is your self-care. And
mhm.
self-care is individualized, like Dr. Chalmers says, for her, journaling is a big thing, and movement is a big thing. For some, it might be listening to music, it might be drawing, doing something tactile is good. They said using their senses is a great way when you're feeling to that point of the big overwhelmed. Start to pull in things that incorporate your senses. Breathe in, taking in, smelling, listening, seeing. And really, it's like that part of, we talk about mindfulness, like, how am I feeling in this moment? And start to just be present. It's a great way to start
Yeah.
when you're in. And that's a great way when you're pausing, to just be present
Mm.
within oneself. Love
Yep.
it.
Yep.
Alrighty, so now with all of this, I do have to ask, you did mention quickly that you did experience burnout. So
Oh
with
my
that,
God.
what did burnout look like for you?
Yeah, burnout was showing up, waking up in the morning, not wanting to go to work. You know,
Mm,
wait, or and Sunday having that trepidation about Monday. Like it's
right,
insane. I don't
right.
longer feel that, by the way, because again, with what I've done, but
Mhm.
burnout is just not being happy. Like you're so,
Yeah,
it's so funny. Like we as physicians, we have such an amazing role and amazing power and responsibility, and we can help so many people. But if you are
yes,
coming from a place of pain and unhappiness,
mhm,
then our ability to help people is much less, right?
absolutely.
But if you're like full of happiness and joy, I mean, again, not rainbows and butterflies, but just like,
No,
just knowing what you're supposed to do and where you're at, then I think it just comes out and people see that. My patients see that I'm happier.
I love it. I love it. So, when you recognized the burnout within yourself, it was the exhaustion, which is, part of the depletion, the emotional depletion. You're just exhausted, and didn't want to go to work, which is weird because this is something that you love to do. And you're
Right?
like,
Yeah.
I love my work, but I do not want to go. So that's how you know that you were in that portion, which we
Mhm.
call burnout, and you were able to adjust portions of your life. And now you're like, I'm excited. I am excited to go in, to talk to my patients, and to deliver the care that I know that I can, and have the impact and change in their lives that's just unimaginable.
Yeah.
Wonderful, wonderful. Alrighty, so here's my fun question of the day.
Ooh.
Ooh. All right, so if you weren't a doctor or an educator, could be, you can't be a teacher.
Oh my God, that was my answer.
I
Okay.
know. I told you. What would you be?
Okay. Okay. I would be so I, college. I was a biology major, and I
Mhm.
really love marine biology. Like I love being in the water, and so I think I would be one of those people that give tours to tourists. Here,
Ooh,
come over here and
and
watch
look at the
the shore.
dolphin. And look at
I don't
this.
know, just
I
being in the
love it.
water.
Oh, wow. So like a tour guide, a tropical tour guide. Is it tropical
Yeah, of
or
course.
oh
Yeah, it has to
my God.
be.
Ooh.
I don't want to be in the ice in our tent.
Hey, you said water. I was just thinking, for me, I was thinking a tropical tour guide. I wanted to make sure,
Yeah.
'cause I'm putting you into my utopia. I need to make sure.
Okay. Yeah, totally. Okay. Now my imagine is rolling. Okay. I want
Oh,
to
I
be
love
a
it.
tropical, and then after working, I'm gonna go hang out in the beach.
Ah,
But,
so we have a tropical tour guide for day and relaxation tour guide for the
yes.
evening.
Maybe meditation also. If you wanna
Ooh,
do
ooh,
that.
wow.
Yeah.
Okay, I'll pay for that
Come
excursion. It's
come
getting
with
better
me.
and better. I love it. I love it. Alrighty. So there are many people who are watching this wonderful conversation, Dr. Troutman, and they're wondering, where can we find you? Where can we be a part of your world? Like, wow, this is just so awesome. And I love that you're focusing on us perimenopausal and menopausal women who, we go through things too. And, yes, we go through the weight gain and, life is changing all around us. And we're like, how can I get a hold of this? So tell
Right.
us, how can they find you?
Right, awesome. So I have a brick and mortar practice in Camp Hill, Pennsylvania. That's central Pennsylvania. But
Mhm.
I do see patients via telemedicine if they live or are physically in the state of Pennsylvania. I'm also on
Love
Facebook
Mhm.
and working on my Instagram.
No worries. So if they're looking for you on Facebook, what are they typing in?
Oh, it's Weight Remedy, WEIGHTREMDY. I am on Instagram. I just don't post as much as I should.
I
And
love it.
I am on LinkedIn as well.
All righty. So are we looking for
And
weight?
my website, sorry, my website is www.weightremedy.net.
I love it. Alrighty. So for those of you guys looking for Dr. Troutman, you can find her on her website, which is Weight Remedy, REMDY. If you
Yeah.
guys caught that, I
Yeah.
caught it and I thought it was very, very good. So Weight Remedy. Also, you can find her on LinkedIn. Is it Case Troutman or is it
Caissa Troutman, full
Caissa
name.
Troutman? Yeah,
Mhm.
Caissa Troutman. And then also on Facebook, where you'll find her at Weight Remedy, also on Facebook. So those are some of the ways that you can get in contact with Dr. Troutman. If you are in Pennsylvania, she's like,
Come see
hey,
me.
come see me in central Pennsylvania. And if you're in Pennsylvania proper at all, anywhere in the state, she's available to take care of you via telemedicine. Alrighty, thank you so much, Dr. Troutman. Any last words for our listeners out there?
Yeah. So let's see. So I would say two things. So
Mm-hmm.
anyone struggling with the medical condition of obesity or the medical condition of perimenopause, menopause, you are not imagining it. Okay. This is not just about willpower.
Mm-hmm.
It's not just in our heads. These are a biological reason. There's a biological reason for these medical conditions. So please get, help, seek help, so you can be treated in a compassionate, not no gaslighting
Mm-hmm.
way. Yeah, because
Love it.
there it is. It's available.
It is available. Love it, love it, love it. Alrighty, thank you so much, Dr. Troutman, for stopping by. Now, I know many of you here, and you're like, okay, if you are looking for a dynamic speaker on stress management and or burnout prevention at your next event, I am she. Send me an email at drbeckford@yourcaringdocs.com. That's Dr. B as in boy, ECKFORD at URCARING.docs.com, where we'll be able to connect with you and make sure that your next event is your best event. Alrighty, some of you are like, oh, there we go, Dr. Beckford. I'm just jumping on and I'm seeing that all these people are watching and I didn't catch all of it. I'm like, have no fear. This wonderful conversation is available on our Your Caring Docs website. Just go to URCARINGDOCS.com and select podcast. And with that, you will be able to see Dr. Chapman's beautiful face, download the episode and send it to 10 10 of your friends, 10 of your lady friends who you know are going through the same thing, that you guys are sitting in and having conversations, sending text messages like, are you feeling this? Are you noticing this? Yes. Well, the conversation is right here. Send it to them so they know it's not in their head, it's not in their minds, and they'll be able to get the information that they need. With that, we're going to end this wonderful conversation. Thank you so much, Dr. Troutman, for stopping by
Thanks for
and
having me.
with us. Oh, this is wonderful. We will see you guys next time. Thank you.
Bye.
Okay, so we have a visitor.
Yes. Talk about live, right?
Exactly. Live and live. All right, bye.